member of the Italian Society of Endodontics. He's the author of over 90 publications on the theme of aesthetic restorations and endodontics. He has a private practice in Naples and in Rome, specialized in aesthetic adhesive restorations and endodontics. Today, he will perform preparation for veneers and cementation of Emax veneers in the aesthetic area.
Already prepared the mock-up, and in a few minutes we will show the beginning of the case. My friend Luis Sardan took this photo, and this is the case before. You can see a reverse smile. You can see discoloration of maybe for tetracycline, so bad aesthetic. So we decided for veneers on the frontal teeth. So I will start. We took an impression. We created a cast model, and then wax up. This is the model. After a small preparation in some little point, this is the wax up, and we had an impression of the wax up. This is the model, and this is the okay, and this is the wax up. So we put the resin inside, and we create the mock-up. We have a different choice. We can start the preparation with the mock-up, or we can start with the silicone guide. Today I will show you the technique with the mock-up. So I usually start with the interproximal preparation. So I will start with these small bars to prepare the two central incisors. Water. Okay, we start the preparation of interproximal, but if you remember the beginning, I just have to prepare a little. I just create a little separation. Okay, now with the second bar, we have the thickness 0.5. Okay, we start the buccal preparation, and I use a different inclination. I use a different inclination of the bars from the cervical part, middle part, incisal part, okay?
In case anybody has any question to ask Dr. Pongione during the procedure, you can do so.
Nice.
So we prepare to the neck of the bird.
So now we are starting with the preparation of the buccal side.
And in three axes, cervical, medial, and
Yes, three different angulation of the bar.
and when you see this black mark here, it means that you are in the good depth of the bird.
So in this case, we didn't remove all the mock-up, so it means that we can't remove enamel, but we just have to remove the mock-up.
Professor Mohammed, we are not hearing you well.
Now we finish the preparation of the buccal side.
So now we remove the excess of the mock-up that was not removed by the gauge, and we stop. Sometimes we don't touch the enamel.
Yes, in this case, for example, maybe we didn't we will not touch the enamel.
And we know that the best bonding for veneers is on enamel, like it was demonstrated by many, by Pascal Magne, by David Gorel and the others.
Professor
Better
Haldane,
to
we can't
bond
hear
on
you.
enamel.
So you can see we didn't touch at the moment the enamel. We still have a little bit
So as you see, we still have some material of the bisacryl from the mock-up. It means that we didn't touch the enamel. So the bonding of our veneers will be totally on enamel, and we all know that the best for the veneers is to bond on enamel. So it's a great case for bonding. And that's why we prepare through the mock-up. So no need to prepare the enamel. All what we do is a finishing line, like Dr. Pongione is doing now, a finishing line just to show our lab technician where to stop and to have a certain space for the ceramic. So also in the preparation, 3 axes, one cervical axe for the gingival part, then another axis for the middle part, and the third axis of the bird in the incisal part. So now we start to touch the enamel.
Okay, now we can start with the inches of reduction, but also in this case we will not touch the enamel because we increased the length.
So after preparing the buccal wall, now Dr. Pongione is preparing the incisal part by making 3 holes as a gauge, and then he will remove the incisal part of the tooth. So as you see, and as you remember, that was a negative smile, and we transform it into a positive one. So now we are also removing a lot of the mock-up and touching a little bit the enamel.
Okay, now I have to finish a little bit and to remove all the
So now the majority of the preparation is done. We will start by the finishing and then we continue by the polishing.
yes. I use a disc. I'm doing just a finishing of the enamel. I didn't remove enamel.
Just polishing, removing the unsupported crisp and making a roundation of all the angles inside the preparation. Roundation inside.
You see, we didn't touch enamel.
You see, we still have bisacryl here. So as you see, we still have bisacryl. So in some places we didn't touch the enamel, the normal enamel.
So it's like a no prep case. So in this case, I just want to modify just a little the interproximal, just to obtain a good integration of the veneers.
The best cases, Dr. Pongione, is when we add material, like in this case, because the teeth was in lingo version, and we decided to add the veneers. That's why we don't touch a lot the enamel, and it's amazing. And as for the smile design, on Saturday, you will see the new application which was launched by Galip Gurel 2 weeks ago in Italy. It's a Rebel. It will be presented in a live presentation also on Saturday morning by one of the team of Dr. Gurel, Georgi Iliev from Bulgaria. We will do a full case, how we do very easily the smile design, and then you can do the mock-up, and then this is the next step, just to do great veneers only by bonding on enamel. So now Dr. Pongione is preparing.
Okay, now I use the cord.
The
Just
retraction cord.
do you have one of this? I put the cord.
And in a lot of cases when you prepare by addition, we are preparing only in enamel, no need for anesthesia. So as you saw in this case, we didn't put anesthesia.
Yeah. So
now retraction cord. Just to be able to finish the finish line on the cervical. So in this case, we are using the 000 not a big retraction cord.
Okay, now you can see there is a small difference in the zenith. So I will not prepare a chamfer, but I will prepare like for a no prep approach with finishing featherage preparation. So with the provisional, with the final veneers, we can adjust the shape of the gum, because if you take a look here, it's a little bit different from here, the zenith. So we have just to give more space here and to reduce a little bit here.
Any questions in the hall? Professor Zeb?
Okay. Metal strip. Okay, we will finish. It's important to avoid sharp angle.
And now all the remaining composite will be removed. Removing the remaining composite, and you see that we are still now in enamel. No sharp angles inside the preparation. So all the angles inside must be rounded, and this before the final polishing of the preparation. And another use of the discs, just to make the angles round and remove the unsupported prism. And before we take the impression, we have to pass a metallic strip, just to let the light go inside and between the teeth and the impression, and let the lab technician be able to sew the limits of each tooth. No problem, no problem. So metallic strip between the teeth, and then
Okay.
okay.
That's okay. I'm finishing.
Finishing the interproximal space. Normally it's done with a metallic strip. So removing all the excess of composites.
Now with the red ring bars, I finished the preparation. Man, you are the best.
So now with a metallic strip, we polish the interproximal limits of the preparation, and we will have a little bit of space for the light, just to give space for the lab technician to see where are the limits and not to be lost in space while preparing the Emax veneers. So we start by doing photos of the case, then impressions, then smile design, then mock-up, then preparing through the mock-up, finishing.
And I finished the preparation using this rubber point. This is a silicone brown rubber point from Shofu. Oh no.
And better to polish with water, not to have raise in the temperature. Don't forget that the pulp cannot afford more than 45 degrees, so we have always to put water when doing the polishing even though.
Okay, and we finished the preparation of this central. Now we can prepare the other tooth. No? Yes? Okay.
Normally in this case we will do 10 veneers, but we don't have time to prepare all of them. So we will prepare now the laterals, and then we will show you another case where we prepare the veneers, and you will see how Dr. Pongione will bond these veneers in the best conditions. So as you see now, so you see that the preparations are very well defined, the limits are really very well defined. You see that it's very well polished. So when you take the impression, the lab technician will be able to see all the limits that was done, and he will be able to execute his veneers in a great way. So
So now I finish the preparation of this other tool.
So you see the color of the dentine is very dark, so we cannot do, in this case, it's pure indication for indirect veneers. So polishing and polishing and polishing and reducing all the sharp angles. And always the angle between the buccal and the incisal part must be rounded, like Dr. Pongione now. He's rounding this part of the tooth and then he will polish with the rubber burr.
So in this case, we didn't prepare anything. I just prepared a little interproximal, just rounded, just created a smooth angle, because are like no prep, okay? Just modified prep. Okay. Now we polish the preparation.
And don't forget to irrigate. Always irrigate when you are polishing. And the polish is mandatory to have a great impression.
Okay, what we did, we just prepared a little interproximal and created a smooth, rounded angle.
So, Dr. Pongione, when you prepare to the part that you see after putting the retraction cord.
Yeah.
It will be slightly under.
Yes.
The
Yes.
Okay.
Put Okay. So now we will show you how to create a provisional using the same mask, okay? Silicone index. We use this resin, okay? Sorry.
So this is bis acryl.
problem.
That will set in 2 minutes. So we place it in the mouth again.
It's not inside. Wait, I want to check.
Try it before. This is the center. Right here. No, here's the center. Here's the center. Okay, now it's good. So you have to place a mark between the centrals so you will not be lost.
Mm-hmm.
So when you place your bisacryl, you will know where is the middle line.
Okay.
So we place again the bisacryl on the centrals. This is the middle. Yes, okay. So now it fit. It's in place, and you see that we have some excess on the cervical part.
We can remove.
Yes. It's better to use this kind of material and not the normal acrylic that we use for prosto temporaries, because this bisacryl doesn't raise the temperature of the tooth while doing the setting. So the normal setting, it's chemo product, and it needs about 2 minutes to set. So now you saw how to prepare 2 teeth, and then we will show you how to bond some veneers regarding the time that we still have. We are short of time, but just to show you the step to make it in the better conditions. It's very hard to wait, but we have to.
Yes.
We check if it's setting or not.
Maybe.
Started to set. We have to thank our patient, Mr. Ghassan, who came from the north, from the south of Lebanon. He came yesterday and he slept in Beirut just to be able to come to this live transmission. So thank you so much. So as you see now, you can see that so you see that we have the provisionals that was made by the silicone. So you see that we have the temporaries that we can leave, especially if you are doing 6 or 8 or 10. No need to bond because it's on enamel. So and no need for etch spot technique also. Or if you want to have better retention of the temporaries,
Yes.
we place a little bit of etching on the buccal surface of the patient of the tooth, and then we place a little bit of bonding, and we put this material, and it will be great for the retention of the temporaries. So now it's done for this case. We have to remove the retraction cord. We will remove it later on, but now we will receive the second patient. So a little break, 2 minutes break, and we'll be back. So now this is the second case. It was prepared for bonding, and the case was prepared by our postgrad student, Dr. Karim Haddad, and the lab work was done by Mr. Ghassan Fghali. So all the veneers were tried in, and just now we will show you how to do the bonding. So you see that they have placed a rubber dam on and special clamps on the centrals. It's the B4 from ivory. So we will bond for each two teeth. We will bond it together, and then when we finish the centrals, we'll put the B4 on the laterals and the canines and so on, just to have the best isolation.
Okay, now we try again the veneers after the clamp positioning. We can start with the two central incisors, and it's important to be sure for the position of the veneers, because sometimes we can have the tilting of the veneers. So it's really important to be sure of the position. Okay. Now I will start with the etching of the veneers. We use hydrofluoric acid.
It's not working.
The needle.
Please change
The needle.
Oh, it's working.
Ah, okay.
So you can, if you have many veneers to bond, you can etch each one alone, or use this device, which is the Veneer Me device. Okay, so on this device you have a net, and you can bond the veneers on this pad. You can bond the veneers, and you etch all of them. But we will not use it now because we are bonding only two veneers. So we start by the hydrochloric acid, and since it's Emax 9.6%.
Okay, so 15 seconds.
15 seconds, not more. It's not like feldspathic. For feldspathic, we need more time than for the Emax. Then we wash, and when we wash, we prepare the surface of the Emax from the inside of the veneers.
So you can see the internal surface of the veneers. The second step could be hot phosphoric acid with a brush. Okay.
So hydrochloric acid, then phosphoric acid 37%, just to remove all the debris that was made by the chemical reaction between the hydrochloric acid and the ceramic.
We rinse again, and then, okay, thank you. And you can see now the surface is more clean. Okay. Then Ceylan.
have to be generous with the silane.
Okay, now one is ready. Second one. The same steps. We start with hydrofluoric acid.
So again, on the second one, hydrochloric acid, then phosphoric acid, then silane. 15 seconds, and then we wash.
Then again,
Phosphoric acid. For how many time?
1 minute. 1 minute.
1 minute. And now time for the silane. After removing the excess of water.
Thank you, Liz.
The surface must be dry before applying the silane in more than one layer. After the silane, it's time for bonding. In this case, you are using the G Premio bond from GC. This is a universal bonding where we have MDP inside. MDP, the phosphorylated monomer, and not the mobile dental photography. So we use this universal. MDP is one of the strongest molecule for bonding. Another layer of bonding on the veneer.
Now we are ready with the veneer. Now we use Teflon.
Now the veneers are prepared. Now we will prepare the tooth for the bonding. So, same steps, etching and bonding. So Teflon, you know, the Teflon is used normally by the plumbers, but we can use it in dentistry. We can use them to protect the adjacent tooth from the etching and the bonding. So this is just for protecting the adhesion tooth when we will apply the etching on the centers, because now first we will bond the centers, and we always bond the two centers together, because if we don't do that, maybe we'll have a problem in the midline. So we always start by those two centers together, and then we go to the laterals and then the canine.
Okay, now we start with the etching.
This instrument is Excesso from Elam, where you can remove the excess of composites and others without harming the natural tooth. It's Excesso. So as you know that for the phosphoric acid on the enamel, we have to pour it more than 15 seconds, not like the dentine. So we can place our etching. And as you see, Dr. Pongione is activating this etching on the enamel just to have more acidic reaction and prepare the enamel to have micro retentions in the enamel just to receive the bonding, and the bonding will bond to the resin of that you will use to bond the veneers. So now you see that the bubbles are coming from the chemical reaction between the enamel and the acid. So it means that now the preparation of the enamel is done in a good way. Before we start to put the water, we remove our acid, and then we start to wash. And we have to wash for more than 15 to 30 seconds just to remove all the debris coming from the chemical reaction between the acid and the enamel. So you see that we are still washing and washing and washing, and not only for a few seconds. We have to wash for more than 15 to 30 seconds. And now you can see that the enamel is very white.
Yes.
It's chalky appearance.
Okay, we don't have problem because there is enamel all around. So we just need.
So now we place again the G Premio bond, the universal from GC, on the enamel, and not only in one layer. Always, as Christensen used to say, be generous with your primer and bonding to have a great result. So more than one layer, and then you remove the excess with a dry microbrush, and then you evaporate the solvent with air. And now the tooth is ready. We have to polymerize, and the tooth is ready and the veneers are ready. All we have to do is add some resin, photopolymerized resin, and place the veneers in place, and we will have the best bonding ever, because always also here in this case we did our best to stay in enamel. So same steps: documentation, impression, mock-up, wax up, mock-up, smile design, and then we prepare through the mock-up, because no need, when we are adding material, no need to prepare all the enamel. We prepare through the mock-up, and then we do a finish line. As you see in this case, you see here the finish line that the lab technician is able to see. So then we take the impression, and we have the veneers ready.
Okay, today I will use for the cementation is like a body mass. Okay, is clear shade because the teeth are clear. So
Okay. So you press with this ultra scaled instrument, press on the veneer just to remove all the excess of the composite. And with the excess, so which is a sharp instrument, we remove the excess. And better to remove the excess before the polymerization, otherwise it will be very hard and difficult to remove the excess with the burr. Because when you remove with the burr, you are removing from the ceramic, and you are removing from the tooth, and you are removing from all the tooth structure. So that's why better to remove all the excess before starting the polymerization. We don't polymerize one veneer on the centrals. We polymerize both of them after seating them on the teeth and eliminating all the excess. This is the excesso instrument. And then we'll use some floss to remove the excess interproximally. All the limits must be closed, and we see that the excess are pushing and coming out. And always removing all the excess. And now remove the excess and with a micro brush. So you see that when you use this kind of clamps, which is the B4, you see all the limits exposed. So you can
Floss.
eliminate all the excess.
Floss.
And we know that the best bonding is done.
Okay, now before starting with the polymerization, we apply the second veneer.
the same. Elimination of the excess.
It's hot.
When you bond two centers together, you will see the midline, you will see the position, the incision line, and all what you have to see for the centers, because you know that the centers are the most prominent and the most aesthetic. So when it's good for the centrals, all the others will be very easy to bond. So that's why you see Dr. Pongione is taking all his time to bond these centrals. And the final setting is a digital one, just to be sure that the veneers are in place. And we hold the veneers and we remove the excess with a floss.
What is it? I think this is the position. This is the position. Yes. Okay, we removed all the excess, and now, please, floss. Okay, this is the position. Now we do all the steps for the polymerization. Around 1 minute from the buccal side and 1 minute from the other side.
So that was for bonding the two centrals. Then we don't have a lot of time. Just to finish all the case, we will finish it offline, and then now we will go to the stage if you have any questions. So thank you, Dr. Pongione.
Thank you very
for our nice patient, and
Thank
see
you
you
very
in
much.
some minutes. Thank you so much.
Thank you, Dr. Pongione. Thank you, Professor Hardin.